o'clock or thereabouts. We talk about things that affect you and your lives economically, financially, just general discussion of the economics of life in general. We're not a financial planning show, so the goal isn't to make you wealthy. There's other people that do that. We've got a lot of good people in the industry that can help you out with that. But generally, what we do is talk about some of the issues or throw out some of the issues that are going on, get you to think about something during the week that might impact you. Everything from international tariffs to local water issues relative to septic to sewer conversions and things like that can affect you on the local level. All of the kinds of things that we that are going on out there that may have an effect on our lives. And we try not to get too political, but some of this is by nature political because of the fact that you got to pay for it. So, and what we talk about is what are the alternatives? How are you going to end up paying for it? What's the trade-off? So it's kind of just a general discussion. My name is Mark Breckbill. I'm a CPA. Have had my own firm in town here for 25 years. And prior to that, was a banker for about 15 years and did that. And then prior to that, I was actually with one of the large CPA firms. So one of the used to be Big Eight, now Final Four. But I was with them. And so, I've had an opportunity to kind of see some things happen at the big company level, the publicly traded companies, the publicly traded banks. I was CFO and COO of banks, at one point CFO of a $500 million bank. So, I've got some background in the banking industry, seen a little bit about what goes on there from a finance standpoint, a banking standpoint, how things are funded, what the issues are. And then, of course, with the CPA, I've had real opportunity to see how local businesses are impacted by some of the things that happen locally and nationally and internationally, and some of the things that take place. So, it is a show where we encourage you to call in if you want to ask a question or comment or even poke holes in it. You can do that. 220-9788, 220-WSTU. Mike is real tough on you, so he's a gatekeeper. He'll keep you from getting in. But if you can slip through that, then we're good to go. We like I say, encourage you to keep it civil and as clean as you possibly can, and we will we'll talk about it. I had a couple things just before we get going this morning. I wanted to mention just kind of a potpourri of, or as they used to say on one of my favorite shows, Laugh-In, potpourri of items. But one of the things I had an opportunity to hear Toby Oberdorf speak a little bit this morning. As many of you know, he's our new representative in the House locally here, and it was he's just finished his first session as a freshman member of the House. And it was interesting. I'm always interested in how they make sausage. That's, they tell you never want to see. There's two things you never want to see. You never want to see how they make sausage, and you never want to see how they pass laws. But
I watched them make sausage. I was fascinated and hungry.
Me too. And that's probably a lot better than how they make laws. It's probably not as disgusting. But anyway, yeah, it's it's interesting. First of all, as a freshman, Toby managed to get some money back here. He got some money back to Indian River State College to use for vocational jobs and funding, which is kind of cool. We really need that. That's a big problem in the economy right now at all levels, not just here locally, but certainly all over the United States. There are no trades anymore, trade schools. There's trades. There's plenty of trades. Every week I hear our electrician, Mike Pettengill from Electrical Connections, talk about how he could hire as many people as he could get that are qualified. But right now, either they don't have the training or they can't pass the drug tests. But, bottom line is, we've got people out there that if they could get the training out of high school could make some pretty decent money. Welders, plumbers, electricians, AC guys, anybody in that kind of construction industry. There's some money out there if they have a good trade like that. And so got to give Toby some kudos for getting that money. It's taken 10 years, I think. So he managed to get in there and get it done. So we appreciate that. And all of the things that were done there. And of course, a lot of that probably was helped out by some things that have been done in the past. But it's good to see some uh, some money coming back into the community for that type of thing, and especially into IRSC. You know, Indian River State College has been a really tremendous resource for us. I think I've mentioned in the past here that uh, it's the only state college in the state of Florida that's allowed to have an accounting course, an accounting degree. It's kind of a quasi. They can't actually call it accounting because the big schools all put the pressure on them to not have a full 4-year degree in accounting. They don't want to lose all the money that's going to the big schools because they can charge the big tuition and they get the big room and board and pay for the campuses and all the money that goes in there. And that's why we need a resource like Indian River State College locally. Florida Atlantic's nice, but some of the classes you got to go all the way down to Boca to take classes. And for many people don't understand that. For many people, let's take the accounting issues. As a CPA, you have to have 5 years of accounting, or you have to have 5 years a degree, or 5 years of credit. It's not all in accounting, but basically you've got an extra year of college that you've got to accomplish in course study to be eligible to sit for the CPA exam. So if somebody wants to be a CPA, it's not good enough that they just have a 4-year degree. But the issue is, and the problem that we've got with that is that, let's say somebody goes and gets a degree in finance. Let's say they have a 4-year degree in finance. Well, if there are no upper level courses offered anywhere around here, they've got to either quit their job. If they, let's say they've already been working and they had this 4-year degree in finance, they decide they want to be a CPA or they want to go and focus on accounting. Well, most of us don't have the money. Once we've left school and we've got a family, we can't just pick up and go back to college for a year and a half or something like that. It becomes not an option. But fortunately for us, we have IRSC. I know an individual who's working in the community, exact thing. He had a finance degree. He decided he wanted to pursue. He was working in an accounting job. He wanted to pursue his CPA. So he went back to IRSC to take some of his upper level courses that are required for him to be able to sit for the exam. So had it not been for IRSC having those courses, if they would have only had the first 2 years of courses that were qualified, he wouldn't be able to, he wouldn't have been able to sit for the exam, or he would have had to leave his family, quit, borrow money, probably a lot more money, because now he's trying to take care of his wife and a baby. So those are the kind of things that I really, think that it's great that we've got a resource like IRC, and I appreciate Toby getting some money there for the vocational training, because we need that. That's good training for people. And it's also Indian River State College does provide a great resource for other businesses as well, to allow us to people to stay here locally or go back to school without quitting their job and giving up their family or doing whatever. So anyway, wanted to mention that was kind of interesting. There were a number of other little interesting things that that we'll see what's going on. It's kind of, it always amazes me. This isn't a knock on Toby. I think he's a pretty conservative guy, but I'm always amazed at, in terms of how intrusive everything, government seems like they feel how intrusive they have to be in our lives. And I understand some, but I don't understand why some of this stuff can't be handled at even a more local level than the state of Florida. But at least it's not being, dictated at the federal level. But there are some things, everything from being able to smoke marijuana from a non-recreational standpoint, medicinal standpoint, versus taking pills. We're getting into all of this. It's amazing all of the regulation we get into on any of these issues. And we're not talking recreational, but just even the medicinal. The regulations that come into play. Um, you can now have gardens in your front yard. You can have vegetable and gardens in your front yard, I guess. I didn't know, and I don't know why the government has to get involved in that. Why isn't that just local ordinances or whatever? But the state now says that you can do that no matter what the city decides you can do. So a lot of these are all trade-offs, and you have to look at it from that standpoint. Even though it's giving people, it appears it's giving people more rights, it's actually shifting those rights to the state and taking them away from the local municipalities. So, in some cases, I mean, I don't know why government has to step in on some of this stuff, but for some reason or another, I guess it does. Somebody got ticked off because they couldn't influence a local election enough to get the zoning changed so that they could have a front yard garden, and now you can. But so there's some of those. One of the big things that I thought was interesting, and this is kind of huge, and I'm not sure whether it's going to be I think it'll be a good thing because it'll create competition. I'm not sure what the issues will be, but as many of you know, our local hospital, Martin Memorial, merged, became part of Cleveland Clinic, which I think will probably be a good thing for healthcare here. And we had a good hospital, I think, to start with. But when you've got the resources of a Cleveland Clinic, it's great. But many of you may remember that there was, for years, Martin Memorial wanted to be in Tradition, which has turned out to be a huge hospital for them, and they've expanded. And I think, frankly, it's probably one of the major reasons that Cleveland Clinic wanted them. But as many of you know, it took a long time for Martin to be able to build in Tradition. At the same time, I don't know if those of you that remember years and years ago, before Martin Memorial South was built, there was a big argument over who was going to get to go there. And the thing was, you had to have a certificate of need, and that certificate of need allowed you to build a hospital. And so you had to show need, but only they weren't going to give multiple certificates of need. So at the time that Martin Memorial South was built, they wanted a hospital in South County because there was a need for one. The closest one down there was in Jupiter Medical, down in Palm Beach County, northern Palm Beach County. And then you had Martin Memorial North. And then Tradition wasn't built at the time, so you didn't even have the western option of going out to western St. Lucie County. So there was definitely a need. It was, the service area was too large, too far, too time consuming to get somebody to the hospital, even on an emergency situation. So there was a need for that facility. And there was a big argument over who should get that, whether it should be Martin Memorial or it should be Jupiter Hospital. And at the time, there were a lot of people that felt like Jupiter Hospital should have gotten that because it would have created some competition that might have reduced prices at the Martin level here in Martin Memorial North. In other words, they thought it would potentially create some competition for Martin North, which was the only hospital that Martin Memorial had at the time. And anyway, it finally, when all of the things got done and everything, Martin Memorial got awarded the certificate of need so that they could build in that location down off of, I think it's Cove. They could build that location down there. So that was a big deal. And actually, for those who've been around a while, it kind of affected healthcare for a while in Martin County, because Martin Memorial had a monopoly on healthcare. The doctors could only go certain places. They weren't allowed to, have rights at Martin Memorial, and still do, stuff at Lawnwood or up at, in Port St. Lucie at the hospital up there. So, which was HCA at the time, and they were going through their own issues. So anyway, it was kind of an interesting thing. And that's that monopoly process we talk about when we say, if you're going to give somebody a monopoly. We talked, I think last week or the week before, about health insurance and the fact that the insurance companies have, in effect, under the Affordable Care Act, have in effect manage to be given an oligopoly or a monopoly type situation. There's only a handful of insurance companies that are large enough to provide insurance, and any of the other ones that are still in that industry, or there's specialty insurers, or are like an Aflac or somebody, or are too small to really compete for the big contracts and for the large services. So what you have is a large number of doctors now having to negotiate with insurance companies, or pharmacists having to negotiate with the insurance companies, and they're smaller and not as not as powerful, and so net effect is, you don't get reimbursed what you should get reimbursed. You have to use drugs that you don't want to use. Um, I was talking to a friend of mine this morning at a business meeting about the pharmaceutical industry, and it's interesting. Certain legislation and that prohibit your pharmacist from discussing with you certain treatment that you're receiving by your or not receiving by your insurance company. It's illegal for them to tell you that, which is amazing. It's amazing that there's stuff like that out there. But that's what happens when you have big, powerful entities on one side and very small entities on the other. The pharmacies themselves are very small. The pharmaceutical companies are very large. The insurance companies are very large. That doesn't make for a competitive price. It doesn't make for competitive services. When you're so powerful that you can tell somebody they can't even tell a patient what you're doing, that's pretty powerful. And that's the kind of stuff that happens when you don't have competition, or you have very limited competition. You have to regulate those guys, because if you don't, this is the kind of stuff you get. So one of the things that happened in this legislation is that the state eliminated the requirement for a certificate of need. What they've said now is it will be a competition situation. And so it'll all be based on free market. If you think that you can provide a good job, do a better job than Cleveland Clinic in South Martin County, then you can go and put a hospital there, and you don't have to have that certificate of need. Now, you might go broke, but that's the market reacting, and so that's the kind of thing. So what happened is the state, again, it's hard to create competition. They can't go out and start a hospital. I mean, they could, but they don't. But what they've done is at least given other private hospitals the opportunity to expand, so that there's a little more competition. And then the market will determine whether that competition is effective or not. Some people will probably still, because that industry still needs to be regulated and controlled, you're probably still going to see some issues coming up. But at least at this point, I know assisted living facilities, or nursing homes, or more nursing homes, hospitals, all of those that require certificates of need, home health care, those kind of things that all require certificates of need, will no longer have to have that. Now, I feel bad for those that already have those certificates of need, because they paid a lot of money for them. I mean, the costs in acquiring a certificate of need are not cheap, and so it's kind of it's a little bit. I know they were paying that money to protect the monopoly. That's how they could do it. They get the monopoly, now they can afford it. But it's gonna make all of that money that they spent relatively relatively worthless. But but it will offer the opportunity. So some of these places that, for example, the nurse registries that want to maybe start to morph a little bit into the home health agencies, they'll be given opportunities to do that, probably without having to have a certificate of need. There'll be other situations, potentially other nursing homes that may start up. Now, again, those are all things that are going to have to be looked at. And you got to, like I say, unless there's a lot of competition, competition can result. I mean, some of these things can result in higher prices until such time as those prices come down. For example, in a situation where I grew up in Peoria, Illinois, I've talked about the effect that Caterpillar had on the insurance and dental and eye care there because of the fact that at the time, this was in the 60s, late 60s and early 70s, Caterpillar had no competition internationally. So when the union would strike, which was United Auto Workers, which is a pretty powerful union, when the union would strike, Caterpillar would just give them whatever they asked for, because then Caterpillar would just increase the price on everything. And frankly, it didn't even have that much impact domestically because Caterpillar was selling a lot of stuff internationally, and so it was actually a situation where other countries were paying for that benefit. Companies internationally were paying for that, and they were big companies that could pass those prices on along as well. But then, as soon as Caterpillar had Komatsu, who started creating a tremendous amount of competition and actually put Caterpillar out of business in some areas. Then all of a sudden, that whole dynamic changed, and Caterpillar at that point, though, had already given away quite a bit of benefits. And you might say, well, that was great, but it wasn't. It was great if you worked for Caterpillar, and by the time this all started shaking out in the 80s, Caterpillar had laid off 12,000 people in Peoria and created, which is not any small number, even though Peoria at that time was a relatively large town. 12,000 jobs are a lot of jobs, and those 12,000 jobs probably influence another 60,000 jobs. So, but I remember at the time, you couldn't go in and get, if you didn't work for Caterpillar. My dad was in the sales business. He worked for a company out of Peoria, but he didn't work for Caterpillar, and they didn't do business with Caterpillar. So they didn't have the ability to adjust their prices. And so when I was a kid, I remember going in and my parents worrying about going to the dentist. I had to have glasses when I was younger. The cost of going for eye care at the time, there wasn't the competition in that industry, and Caterpillar paid for everything. So if you needed dental work, braces, whatever, Caterpillar paid all of that. There was no deductibles; they just paid it all. So naturally, all the providers raised their prices because Caterpillar paid it no matter what. They raised their prices. There was no competition in general, and the competition there was on the other side, the person saying, "We'll pay whatever you charge us." So, yeah, everybody raised it, and for a while there was a couple of the companies there was a couple of the doctors and that used to ask the question, "Well, do you have Caterpillar insurance?" And if you said no, then they would reduce their price. But then that was illegal. So those doctors got sued for doing that. They were told you can't do that. If you offer a discount, you have to offer it to everybody, including Caterpillar. And so they said, well, we're just not going to offer the discount. And that's exactly what happened. So as a result, in Peoria, Illinois, in the 70s, late 60s and 70s, things like eye care and dental, and even your local family physician, they were extremely expensive. And those of us that didn't have Caterpillar insurance couldn't afford the coverage. We had to pick and choose how we were going to get our health care. And that was because we allowed one company to basically dictate what was going to be paid, because they just paid everything. Anyway, it was kind of an interesting, it kind of shows what's happening. But what I was getting at there is, in Peoria at the time too, we had two major hospitals. We had St. Francis, which was the Catholic hospital, and then Methodist, which was the other big hospital. There were these two large hospitals that were literally within 2 blocks of each other. That's how close they were in downtown Peoria. And they were big facilities. But I remember at the time, there was a tremendous amount of competition. And in those days, there was competition. And so what happened is the competition was for the doctors, because they wanted the doctors to be able to use the hospital. So for surgeries and deliveries and all of those kind of things. So it was interesting, because what they ended up doing was there became this escalating this escalating war between the two hospitals to buy the latest and greatest equipment, MRIs and all kinds of imaging, things that were cutting edge at the time. And they cost $500,000, $750,000. And Peoria wasn't large enough to justify two of them or three of these types of things. So it didn't make sense for Methodist and for St. Francis both to have this equipment, but they both had to have the equipment. Otherwise, the doctors wouldn't want rights at their hospital. They would go to the other hospital. So it became this escalating process. And at the time, it got out of hand because who's paying for it? Caterpillar. They don't care. They're paying for it all. So these hospitals could keep buying the latest and greatest. It was great for medical care in terms of, the doctors and the physicians and everything in Peoria had some of the greatest pieces of equipment possible. And nobody, even more so than some of the larger cities around it, because of the fact that if a hospital had done that, if a couple hospitals had done that in another city, the insurance companies would say, we're not paying for that. We're not paying that kind of price. But basically what happened is both of the hospitals could pass those costs along full force, even though, it just got embedded in the costs of other medical treatments that you'd have. And again, for those of us that didn't have Caterpillar insurance, killed us. We couldn't afford any of that. I remember going through that whole process. So it's interesting. So we'll see what happens with the certificate of need. It would be nice to say and it's great that they've introduced a little competition in the process. But as I said, until you've got a situation where there's enough competition on all sides of the equation, you are going to be, you're going to have problems. So, for example, and it could be the opposite situation. Insurance companies are so powerful now that if somebody starts a hospital down there, they may say, we're not going to cover that hospital. We're not going to have a contract with that hospital because we already got hospitals that we're covering nearby, and we're not going to cover that hospital. So is that fair? No. And is it going to create competition? No, because the insurance companies can control what they reimburse. So if they turn around and say, you know what, you're not part of our plan. Let's say Jupiter Memorial decides to, Jupiter Hospital decides to put another hospital out by 95 at Canner or someplace in that range, or maybe down Canner a little bit so that it's a central area. Well, Western Central, it's going to be right in between Tradition and Martin South. It's altogether possible, probably probable, because they can afford to do it, that Blue Cross Blue Shield will say, we're not going to cover you go there. That's out of network. So you're going to pay. If you go there, you're going to pay yourself. Can they get away with it? Yeah, because what's the competition? Can I go to somebody else that might cover that? Maybe, but probably not, because there's only 2 or 3 of them, and they all may say, well, we got enough hospitals here, we're not going to pay it. So it's nice to say, well, okay, we'll let the free market decide, but the free market's controlled in this case by the health insurance company, and in this case, Blue Cross Blue Shield, maybe to some degree Aetna, and they're going to determine what happens. So anyway, it's kind of interesting. It's kind of interesting to see what happens, and that's the type of thing that I kind of want to bring to light here, is that when you start looking at all of these things, it's the economics of what's going on behind the scenes and where the competition really lies. Many times we look at stuff and we say, oh, we want a free market, but we aren't there yet. What we have to do is start creating an avenue to a free market. So the legislature did that. They've taken away a burden so that maybe a smaller specialty hospital wants to come in, whereas before, you would have to be so large to get a CON. You'd have to be so large that you covered and provided a lot of services. Now, maybe you won't have to. Maybe it'll open up the door for, maybe more nursing homes, or maybe lower income nursing homes, things like that. So, because they will have the opportunity. But until you take care of the insurance side of the business, where there isn't any competition, you've got competition among the doctors and the people providing services. You have limited competition in the hospital area, but a little bit. That now could could become more competition, but you still got one leg of that stool that's going to be all powerful, and that's the insurance companies, until we find some way to make more competition there, and create some situation where there's an alternative, because they're going to control the price at that point, and of course they're going to extract a profit that's larger than they should, because they have the ability to. They will always. That's the thing about free enterprise, is if there is no competition, you will not have fair price, and it's usually not on the low side. You are going to have a company that loosely is going to gouge you, because they can. And their goal for their shareholders or their owners or whoever, in some cases, the nonprofit hospitals or the nonprofit, the entities that we've had in the past, it's for their officers. But the bottom line is they're going to maximize that because they can. And that's, and unless they're regulated in some manner, there's not enough competition in their industry to force a competitive price, a fair price, it's called, when you have competition. And so it's going to be interesting to see what happens there. It's a good path. I mean, the stuff that's being done to allow insurance companies from out of state to come into the state of Florida. It's interesting that Blue Cross Blue Shield of Michigan can't come to Florida and offer insurance. Blue Cross Blue Shield of Florida, in effect, has a monopoly on that from a Blue Cross standpoint. So let's say somebody else is more efficient as an insurance company. Somebody is doing a better job. You can't have that competition. The state freezes them out. They don't allow that. Now, more and more, they're looking at opening up avenues to create more regional insurance companies and regional competition, at least, that will. And it's funny. It's you say, well, why is Blue Cross Blue Shield of Michigan? Well, Blue Cross Blue Shield of Michigan and a couple of the others in the northern and central states have they offer a lot of health insurance for trades organizations, because they always have been involved with the unions and trades. So they offer a lot of specialized insurance for trade organizations and for membership organizations, like the Chamber of Commerce and places like that. They offer the insurance that covers those specialty type policies that are geared directly for that particular industry. There's a lot of industries out there, for example, where let's say the printing business, there's a lot of small printers out there. There's not, and they don't have the clout to negotiate their own contract with doctors. Together and says, hey, individually we've got we've got 1, 2, 3. You're individually competing here. It's a mom and pop shop, but the trade organization takes them and puts them all together, like a Chamber of Commerce, puts them all together and says, okay, now I've got 1,000 businesses here that are going to potentially buy insurance. What can you offer me for 1,000? And that's just here. So now let's say that those trade organizations are all over the United States. Now they're bringing 50, 60, 70, 100,000, 200,000, 300,000 businesses to the table and saying, my people need some sort of coverage. We need either, high deductible HSA coverage, or we need disaster coverage, or we need HMO type coverage, or whatever. Can you offer us a package that we can sell to that we can offer to our tradespeople? And of course, from the trade association, whether, like I say, like the chamber or somebody else, that gets somebody to want to be a member so they can participate in that. It's another member service that's offered. And so those are the kind of things that ultimately can create the competition. But if you say, you know what, chamber, you can't bring in this organization that's got a contract with the U.S. Chamber of Commerce to provide insurance to all of the Chamber of Commerces around the United States, we're not going to let you bring them into the state of Florida. They're not approved for the state of Florida. Well, what does that mean? That means whoever is approved here now can charge a higher price. because you eliminated competition. So those are the kind of things that we have to be careful of when we talk about either free enterprise or regulating insurance or single payer or whatever we're talking about. Ultimately, if anybody becomes too strong, even if it's the government in that process, the government will dictate. People think, well, is that a bad thing? It may not be a bad thing from your standpoint if they're dictating the price, because they may be forcing an artificially low price so that people get it cheap. They may be paying less or agreeing to reimburse less for something because they can. They're the government. They're powerful. They're big. They're the major competitor, and they have no real competition. They have no competition in the United States. Sometimes the states can force competition, but they usually don't. So now the federal government say, well, okay, that's great. The price of healthcare will go down. Well, yes, maybe. Or if I'm in that situation and my price goes down, for example, if you tell me as a CPA the maximum you can charge for a tax return is $100, then I can tell you what you're going to get. And you're not going to get to meet with me. I can't afford that anymore. You're going to mail in your stuff. I'm going to get to it when I can. And you're going to, you're going to wait. I'm not going to spend any time trying to figure out a way to save you taxes, because there's no money for that. I'm not being paid for that because I have expenses. And so if I'm only getting $100, what it means now is that that someone has said to me, Mark, you can't have only 500 or 1,000 clients. You have to have 10,000 clients to be able to cover your costs. Well, one person and 10,000 clients, I'm not spending, I'm going to be like a doctor. I'm going to have somebody else, maybe the receptionist will talk to you. They might have 5 minutes, but it's going to be like going to the doctor's office when you don't get, look at how much of what's done in a doctor's office now is done not by the doctor or even the physician's assistant. There are now, you say, well, that's good. They're reducing the cost. But that was the day when people were filling out those forms that are now done by other people because they can't afford to have a doctor go in and do that because they don't get paid for it. Where doctors used to be able to talk to you and find out a little bit of information. They were filling out a form, but at the same time, it was the doctor. So they were saying, oh, your mom has, had this happen or something like that. Now what's happening is this person's accumulating that information and they're giving it to the the doctor, and the doctor's looking at the form. You're saying, so it's the same thing. The doctor can just do it at their own time and they're looking at it. So it's not going to affect my care. Well, yes, it will, because the medical assistant, who's not a doctor, didn't know when you kind of made an offhanded remark about, nobody in my family has lived past 60 or something. The doctor would kind of pick up on that. The medical assistant, they're just getting information. Nope, mom is deceased. Father is deceased. There was no notation that none of them lived beyond 60, right? Which might be something that the doctor would want to know. But that's what I'm getting at. It does affect the quality of care. So there's going to be a trade-off. When the government's involved, they are going to regulate service. Look at the VA hospitals. Look at how the service there has been regulated. Because a veteran couldn't go to a private hospital. They had to go to a veterans hospital. There's not veterans hospitals all around here. So that means that somebody had to go, either they had to wait for care, they had to wait to get in, they had to go to a location that's not around here. Many times you're talking about older people that had to get transportation, all of those kind of things. And that transportation gets expensive. If I have to have somebody drive me down to West Palm, it's a whole lot different than having somebody drive me to, Tradition or to downtown Stewart. So those are the kind of things it does. We don't see them sometimes, but that's what you have to understand is when somebody comes in, even the government, even trying to do good, they can't or don't. They just can't, because they can't figure out all of the issues that they're going to create. So you say, okay, we'll be a single payer, it'll be the same as Medicare. Well, there are a lot of problems with Medicare. and there are a lot of problems with Medicaid. Why? Because Medicare assumes that the doctor or the hospital is providing coverage to Medicare patients as ancillary coverage. In other words, what I mean by that is that you already have your hospital, you already have your doctor's practice, you have a bunch of patients already. They're already there. They're paying for the building. They're paying for your reception area. They're paying for your receptionist. They're paying for the medical assistant. They're paying for all of that. They're already covering that through their private patient insurance. That all of that's being covered. So when Medicare comes in and prices or agrees to reimburse, they agree to reimburse based on a variable cost model. From an accounting standpoint, what that means is I have in my business, in any business, you have a couple different kinds of costs. One are fixed costs and one are variable costs. So fixed costs, for example, is my building. In my situation, I have to have an office. So I've got a lease or I've got an office space. So that office space is a cost that I have regardless of how many people show up. Whether I have 100 clients or I have 1,000 clients, I still have got my monthly cost for my rent and I have to pay it. Now, if for some reason, if I start doubling the amount of clients I've got, then I may need a bigger space. So those fixed costs do change. In fact, every fixed cost is a variable cost over the long run. But in the short run, and that short run may be 5 years, it may be 10 years, it may be whatever. If I've signed a lease, I got a 5-year lease. That's my cost for 5 years. I may need more space later. I may need additional space, whatever. But I've got that fixed cost. So Medicare comes in and says, well, we're not going to reimburse you for a percentage of that fixed cost because your other patients are already covering it. You already had that cost. So we're not going to reimburse for it. So they say, we're only going to reimburse for variable costs. In other words, those are the costs that are directly related to the service that you have to provide. So for example, when the doctor comes in, they're going to reimburse you for just the labor time that the doctor is there. They're not reimbursing you for the cost of the waiting time in the lobby. They're not they're not reimbursing you for all of that. They're reimbursing you for how long it should take the doctor to handle you. So they're going to say, well, that's 15 minutes. A doctor shouldn't spend more than on a normal call, shouldn't spend more than 15 minutes. We're going to reimburse for 15 minutes. Well, that 15 minutes may cover the doctor's insurance, but the doctor's cost if they keep their appointment to 15 minutes or less. And in fact, because they can cover that. So that makes sense if you do have 1,000 patients and only 100 of them are Medicare. But what about if it's Florida and you have 1,000 patients and 900 are Medicare? Who's covering that fixed cost? Who's going to pay for that? Only those last 100 patients that aren't covered by Medicare. Well, what if those don't exist anymore because everybody's covered by Medicare? Cost has got to go up, service has got to go down. So what I got to do is either I'm being paid for 15 minutes, I got to find a way for that to be 5. And that way the other 2/3 of that can pay for me to have an office and a receptionist and somebody to answer the phone. What have most of the doctors done? They don't answer the phone anymore, right? How long does it take to get back to for a doctor to get back to you, or for you to get into your doctor, even to schedule an appointment? How long does it take for you to schedule an appointment with certain specialists? Months, 6 months, 7 months, 8 months. Why is that? Well, it's because they have less and less money that's being paid, that's being given to them for coverage of patients that are at full price. It's being done under discounted programs, HMO programs, other programs dictated by the insurance company that require less reimbursement. If the government takes over, none of that changes. The government just becomes the bully, like the insurance company was, and they take over for the insurance company. They just become the person that dictates price. And if they dictate a price, that is not enough to reimburse, which they won't in a state like Florida. Florida's got a real problem with healthcare if that situation occurs. If there becomes only a single payer in Florida, we will lose healthcare. If Medicare was the only provider in Florida, we will lose healthcare, including a large portion of Medicare, because at that point, there would be no private insurance to support Medicare, and Medicare costs will have to go up or service will have to go down. And when I say service has to go down, what I mean is you can't get it. If you need your eyes taken care of because you're going blind, you may be determined that you're too old for that. If you have certain coverage that has to be done, transplants that have to be done, you may be deemed to be too old for that, or not acceptable risk. What if you've got an addiction and an alcohol problem or a drug problem? Maybe you've beaten that addiction, but it hasn't been that long. Now, all of a sudden, all the damage that's been done by that addiction, is the government going to replace that? Are they going to take care of that? They may say, you're not a good risk. You're not going to live that long. We're not going to do that. We'll do something less. Yes, we'll do something. It'll be less. So you won't have a great quality of life. You won't have no quality of life. You'll have somewhere in between. It'll be a limited quality of life, but that's okay for you because you screwed yourself up. So we're not going to fix you. So trust me, that's not exactly the way that that's the economic version. Those statements are the economic version of what's going to happen if you end up with any type of monopoly in a system, even if the government is the one controlling it, because they can't control everything. And ultimately their pricing right now is messed up. The reason that Medicare is cheaper is because of the fact that there are a large number of patients out there around the United States that are paying full price. They're paying the fixed costs, not just variable costs. If it all became a variable pricing system, you can't survive. There's no way that you can provide those services. So anyway, it's interesting. Those are the kind of things that we struggle with, and it's impacting us every day. We hear about some of the stuff that's happening that the state legislature is trying to step in. We're finding, situations where the federal government's talking about doing stuff. All of these things have impacts. I got to give, Toby some credit and the governor some credit for getting some things done, particularly on the environment. It's pretty cool. Last thing I wanted to mention, and I don't have the date. Maybe Mike has the date. There is a workshop coming up in the city of Stuart, coming up here in the near future on the plastics issue. And I don't care, you may not believe that we have problems with plastics. You may not believe all of that. You may not believe it's the government's job to get involved and do that. I'm one of those kind of people who likes the government to stay out of my life, but it doesn't mean that you shouldn't do something about it. I mean, let's face it. Anything we do is better than nothing. And even if it turns out we don't have a plastics problem, if we took steps to help potentially correct it, if we did, isn't that a good thing? Especially if that doesn't really cost us anything. It doesn't do much. I mean, how hard is it really to carry a cloth bag into the grocery store when you go get your groceries? I mean, I know we forget all the time, but how hard is it to do that? Actually, though, I suggested to Fresh Mark and Publix the other day, they ought to have clubs where you pay a certain amount per year, $50, $100 a year. And then when you forget your bag, they give you one from the store. And then at some point in time, you run out of your credit. So you bring all those bags back so you can replenish your account. That would be good, because that's my only problem is I finally have gotten all the way into the store and realized, oh, I left my bag in my truck. So anyway, but how hard is it to do that? I want to give a kudos to Stuart Coffee for the cool pasta straws that they're now using for some of their stuff. And so see what people are doing, every little bit helps. Stuart Coffee's gone to some plates instead of any kind of styrofoam or paper. They're using the pasta straws, which are biodegradable, all of those kind of things. We can all do a part. The government doesn't have to tell us to do it, and they don't have to fine us for not doing it. We can all voluntarily participate. So anyway, everything we can do doesn't mean we shouldn't do it, and we don't need the government to tell us to do it. But anyway, that's it for this morning. Hopefully, it made you think about some things. That's what we try to do, is just throw some stuff out there for people to think. And appreciate you joining us right here on Treasure Coast Solutions, WSTU Digital 1450, we're Martin County's Heritage Station.